Good afternoon, I believe morning for some folks. I am Tiffany Iheanacho. I am the Justice Services Director for Buncombe County. Asheville is the city seat for the county. So we're in the western part of North Carolina. The city itself has a population about 90 to 100,000 and a community size about 250. So not relatively big, but not terribly small. But we see ourselves, in this nationwide effort to address racial equity. So in alignment with some of the principles, I've been able to talk to Lisa in the Prevention Institute to talk through what we're doing. We've been working with them for about a year, just in our community violence work. However, we have been embarking down racial equity for a few years as a community. We're not all the way there yet. We don't have the answers, but I can share kind of some lessons learned. A part of the work in our criminal justice was our partnership with the MacArthur Foundation and their Safety and Justice Challenge, which gave us a lot of money and area for innovation to do not only just reducing our local jail population, but looking at how do we engage community and address racial and ethnic disparities. So with that, we were able to do a lot of listening sessions in communities, working with communities, doing surveys. We have a coordinated criminal justice council and a coordinated response to domestic violence. We have members that are part of the community that we've been able to give stipends to participate and value their time. I'm getting emails from our county clerk's office and our communication team about, I think most recently last week, about how do we land on the amount that we're paying our community members. The plan is for the county to do it kind of countywide with all their board and commissions. A part of our community violence and safety work, we realized we weren't the experts and we wanted to invest our dollars in community. We were awarded the ARPA funds. I think many people are using ARPA funds to do creative things that we traditionally didn't have money to do. And then we also received federal dollars to start our community violence work. Majority of that work is going to community. I think kind of Principle 4 talks about us having an actual violence prevention coordinator, and that's kind of just the county staff support to make sure things happen. That's majority of where our funding is going. We also allocated money to provide mental health and wellness support. And it's a lot to not only be in community working to help undo racism, especially through a public health and anti-violence lens. Folks are they are from community, right? The people we're working with, family members, loved ones, and they also can experience vicarious trauma. So making sure they have the support along with those directly impacted. Many of the folks who are working in community, working with the youth, have had personal connections with gun violence. Some of the staff, including myself, have loved ones who've been murdered. So it can be a burden to try to make change while also being kind of indirectly impacted. And that's part of the shared understanding of structural racism. We was planning this process, but COVID and the murder of George Floyd just like made us move a little bit faster. So we partnered with Racial Equity Institute that did a lot of trainings across the country. They're originally from Greensboro. We brought them in, they held sessions, their groundwater, which looks at data, but their REI phase 1 that really looked at the 2-day process. And as we created space, we also created our own 8-hour racial equity training that happened to be a part of the team. And we rolled it out to countywide and included some of our court partners because it's important not only for the county to have this information and knowledge, but our systems that we interact with, our institutions, our anchor institutions. We've been addressing and continue to address the harm mentioned. In 2021, our city and our county came together and created a community reparation commission looking at 5 impact focus areas. Asheville was affected by an urban renewal policy, so not only redlining, but the systematic removal of African-American families from their neighborhoods with promises that they can return, which didn't happen. They ended up placing folks in public housing. And I think there was a comment in the chat about that. It's these systems were created, and now we're dealing with the effects, and we're trying to undo racism by not only addressing and creating solutions for people that are directly involved, but also simultaneously trying to undo policies and practices. We have a component for workforce development, resiliency training. Again, it's principle 4. A part of the office I saw in the chat about why did we do both. I think it was always our intention to do our own training, just as a part of our organizational development. We have a organization and development team within our HR department that was created. So, but we also wanted to, many of us have, especially the training team, have backgrounds in equity. So using content and material that tells our own story, RAI is great and other institutions are great, but especially for public servants and our government work, how does this impact them? So being able to look at our own local data, look at the public service that we're providing, the policies that we're implementing through our equity lens. One of our last modules, the end is like putting work into practice. So we give them some policies that they look at, and they're to come up with ways that they can use an anti-racist lens. I think one example is our recruiting practice. So we heard people say we need to be more inclusive. We need to look at our hiring team, not just the staff on your team, but getting other diverse perspectives. I think one policy was about bounce checks. And so they recognized like who's more likely to be affected by return fees, right? So eliminating that. I think our libraries last year removed late fees from their library. So I think that kind of is the understanding of why we just wanted to make sure it was intentional and not just training folks for the sake of training. And lastly, and I'll show on these other slides, on be cognizant of time, like how we're putting our data to action and creation of a racial equity action plan. I will say getting equity to the forefront was not easy. The commissioners did a strategic plan in 2020 and equity was not at the table. They were looking at data from other perspectives. And when we started holding community sessions, we're calling people, say, I need you at this meeting, like equity is going to get missed. You need to show up, you need to represent. And they heard it at every single meeting. And not only did equity become a part of our strategic plan, it's in our core values as an organization. That led to us declaring racism not only a public health crisis, but a public safety crisis. Both our Health and Human Service Board and our Coordinated Criminal Justice Council independently created their declarations and provided them to the commissioners for adoption, and we unified the resolution. It led to the reparations, it led to a non-discrimination ordinance. It also led to the creation of the Equity Office and Human Rights Office. And we're still causing harm in our institutions. Like, we're creating work, but there's things that we're working on that have been detrimental. So it sounds like, we're doing a lot of great work, but it's not a easy task. I often say, someone told me it's not a sprint, it's a marathon. I've taken it to say it's one long relay race, and we just have to pass the baton because we've gotten this way after 400 years. So we're not going to resolve it in 1 or 2 resolutions. If we go to the next slide, I'll talk more specifically. I'll show you all. That is an image of me. That was maybe 5 years ago. They were taking pictures and like, oh, we need people. I told them we're going to retire that picture. But when I first got to the county, there was not many African Americans represented. So we would see each other, we would give a head nod and go back to our offices and not have interactions with Black people for days. We decided to do an affinity group. So that was like one of the first coordinated efforts of getting people in spaces. And that's what that image is of our affinity group. But I wanted to highlight the improved justice outcomes for impacted communities as a part of our racial equity plan. If you go on the county's website, there's several different buckets of public policy area, education, housing, justice, and then our foundational work we do as a government. Specifically looking at our community violence work, We were partnered with Asheville Police Department. They presented at if we go to the next slide, I can show that data. And that ties into Principle 5. As part of our partnership with the Safety and Justice Challenge, the, I believe, American Prosecution Association wanted to come to Asheville. Their topic was addressing victimization. Our DA and our Asheville Police Department put together a presentation. So we looked at, and I told you we're a very small community. We have big city problems sometimes. So our APD data analysts looked at a 10-year overview of kind of violence and crimes in our community. So we did a census, and of course the census came out. Our Black residents population dropped from 13% to 11%. Now that's just Asheville City. Buncombe County is 5 to 6%. So that percentage is represented in that number. But the number of the population compared to the violent victims are about a third. And that number rose as well. If you look at the hotspots, we're doing a community health index with GIS. One of the things to note, these like pocket areas, and many of you won't be surprised, were some of the same places where public housing exists. And it also includes areas of the urban renewal where property and land and businesses and grocery stores and Black businesses were thriving, were sold or bought, sold, and kind of demolished. So if you look at the overlay, that was important for us as well. And if you go to the next slide, this is just an overall 5-year review and looking at specific charges. And then 39% of all Black victims of crime were victimized within public housing. And then over the 5 years, only 12% of property crimes were Black. So this just gives you kind of the disproportionality. So what we've been doing, like I mentioned, our ARPA funds, our community violence prevention work. My final slide is just showcasing like ways we're trying to address this particular area. This is actually taken in one of our communities a few weeks ago. The Mothers of Gun Violence, Love is their support group, have come together to do a lot of community building. So we sponsored with some funding to get bouncy houses, food, and get community out. A part of our work is workforce development, intergenerational empowerment. This picture was taken in Hillcrest. My great-grandmother lived there, and she had the first apartment. Her yard, she loved flowers, was covered in flowers. And so the intentionality of intergenerational empowerment is getting the grandmas and the great-grandmas back outside, feeling safe to take ownership in their community as well. Working with youth, creating a youth advisory council, improving the built environment, making sure our structures look like a place people want to live, work, and play and thrive. So making investments in that. Of course, the kind of boots on the ground work is Community Healing Initiative, partnering with community health workers to be in our communities, working with youth, work with those impacted. Coalition building, we all think similar to our coordinated community response to domestic violence. Like almost 10 years ago, Buncombe tied the second highest for domestic violence homicides. And so we coordinated, got together, and we established very different aspects, one being a family justice center. So this is something similar, like how does each institution have ownership in addressing this? And then of course, I mentioned previously providing mental health support as we do the work. So these are just some examples of how we plan to address and do our community violence work through community-based prevention work. We have worked with Chasm. They're out of Wilmington. They are great folks. I would need to get I always forget what Chasm stands for. I'm pretty sure many remember. I know it's like mobilization and activization, community healing through advocacy and mobilization. But they have helped put it together. And thanks for putting it in the chat. So thank you all for letting me share all the work we're doing.
Amazing
questions.
Yeah, amazing work, Tiffany. Really, yeah, just thank you. And Will, what's coming up in the chat in terms of questions and comments?
Yeah, lots of good comments and questions. Thank you so much, Tiffany, and welcoming any additional questions. If we can't get to them right now, we'll definitely start answering some in the chat as well. I want to start with the most recent one, or the last one that was sent, Tiffany. Jason asks for some clarification on how you started the affinity groups and any challenges or resistance that you faced along the way.
Yes, I laughed when I saw that. So actually, I just went to my supervisor and she's an ally, and I expressed concerns like it is so isolating. I'd be in spaces, be the only Black person, and then we would give like the head nod if we saw somebody else. And someone gave me the idea and said there are affinity groups. We partnered with the city of Asheville, who had a equity office at the time, but some of the pushback, of course, people were wondering, and they were even questioning Black History Month, why we have Black History Month, and someone said White History Month is every day. And so like we just countered the narrative. I think counter narrative is important. Our HR director almost clutched her pearls at the thought of doing something like this. I think one of the things, it was okay for us to do it in like at the lunch table, but we asked for funding. We followed the meeting policy, and we requested food. We requested during lunchtime because people had difficulty. We wanted to reduce the barriers. I think we eventually started doing it quietly, but then I think what led to it being acceptable is educating. So we have our intranet, and we release a lot of articles about why the county is doing what they're doing. So we just said, here's some statistics about retention, about recruitment, and we didn't end up developing an affinity policy. We have a second one at play, and that's the BU, that's for LGBTQIA+. So we just build on, the information that's being provided, and we didn't let, because we had support from community, from county leadership and city leadership, we didn't let certain folks stop us from doing the great work.